I'd like to introduce our presenter, Swetha Ranasuriya. Swetha is a person-centered therapist and counselor who believes in human potential. She approaches the therapeutic space from a variety of experiences gained through her personal and professional life. Swetha is a registered clinical counselor and a registered Canadian art therapist. Swetha, please take it away.
So I'll be providing a brief introduction to art therapy. So definitely this is a very quick version, but I am hoping to communicate to all of you the benefits of art therapy. And if you are not familiar or you haven't really thought of art therapy, haven't heard about it, then it will give you, I'm hoping it will give you a starting point to look into art therapy as an option. And also give some good information about what to look out for when you're looking for an art therapist, where to look for an art therapist. There are even places that you can access free or affordable art therapy. So I'll be sharing a bit about that as well. So I'll start first with what is art therapy. So art therapy is a combination of psychotherapy and creative process. So it uses psychological theories and then combines it with art making and creative processes. And I say creative process because it could be anything that is seen as creative. Sometimes art therapy and expressive arts therapy might be identified together. So expressive art therapy would be therapy that uses music, drama, dance, and art all together. Art therapy is very specifically about using art and the creative processes behind that. So I want to make that distinction, but also art and creative process is used as a way to express thoughts and feelings. And sometimes in art therapy, we do go in and out of some of those other ways of expressing ourselves. And that's basically the basis, very, very foundation of art therapy. Art therapists will work from many different backgrounds. So all the counseling backgrounds and types of ways of approaching counseling and therapy, art therapists will also have those ways of working, and they're just incorporating the art and the creative process into that way of working. So I will also talk about who can be an art therapist. So I identified myself as an art therapist. I'm also a clinical counselor. So the designations and all the different titles can get a bit confusing. So I wanted to make sure that I can clarify a little bit about what art therapy is and who can actually say that they're an art therapist. So speaking for myself, I am trained to be an art therapist. And usually art therapists have a master's level degree and then they have specific training in art therapy. So therapists with graduate level training in art therapy would be people who are identifying themselves as art therapists. And I also included in my PowerPoint here a few of the designations that you might see. So you will see DVADI, DCATI, DTATI, and those are actually art therapy schools and institutes in Canada. So VADI is the Vancouver Art Therapy Institute, TADI is the Toronto Art Therapy Institute. So you might see that designation in a therapist's after a therapist's name. That would mean that they are trained specifically in art therapy. There are also some master's level programs that are in art therapy, so I've included that as well. There's also registered level art therapists, and they have additional training. They've completed additional supervision, and they have completed a set number of client hours. So I'm a registered art therapist as well, and you will see that they have a different or additional designation that will be BCATR if they are a registered BC art therapist. RCAT is if they are registered with the Canadian Art Therapy Association, for example. So basically, it is there are designations. So not anyone can call themselves an art therapist in Canada, and they need to be someone who's trained specifically to be an art therapist and has those either one of those designations. And as art therapists, we have to be accepted into provincial or the Canadian Art Therapy Association. We have codes of conduct and standards of practice that we have to abide by or work within. We also, like other counseling and psychotherapy professions, have to have liability insurance to have our professional or registered designation. And that's really important to know, because that is part of our responsibility as therapists and art therapists for our clients. So when you're looking at practitioners, it's really good to be aware that if you are seeing those designations, that also means that we have a code of conduct that we have to work within, and also we are insured. Yeah, so I'll go into how art therapy works. So sometimes it can be very confusing to think about how does art therapy even work within a therapy space. I'm in my studio right now, so it's a different way of working than if you were in a talk therapy counseling environment. There's a lot of supplies, there are a lot of options, I like to think, but also as an art therapist, I also have areas where we can talk, but then if that is not an option, or if that's a struggle, then we move into the art. The origins of psychotherapy looked at imagination and how to use our imagination to explore pain that we experience as human beings, and also how to explore healing that pain. And the arts in all the forms are rooted in imagination. So it makes sense that we can use art to reflect our pain and to also reflect our healing. And that is basically the guiding principle behind art therapy for myself anyways. And art therapy enables us to express our thoughts, feelings, perspectives, and it gives us another way to express those things beyond words. And some of our thoughts as human beings, some of our feelings, some of our experiences can be beyond words, and that's where the art that really helps and facilitates us to be able to take a look at where is the pain coming from, and then where can I go for healing. So it's really a different way of looking at ourselves and reflecting on what can really help us. So the art therapist in that space, sometimes I will talk about misconceptions as well. One of the misconceptions I want to get into is also the art therapist as interpreting or trying to figure out what the art is about. And we really step away from that as art therapists. And I can speak for myself, I'm not there to interpret a client's work. I am not there to say, oh, you use blue, that must mean blank. We actually stay very far away from that. It's more about, what does that mean to you? What does blue mean to you? It's very personalized, and it's about holding that space for the client to express what the art means. Some of the other misconceptions beyond what clients come in and expect from art therapy, I've heard a lot of, I'm not an artist, I can't draw, or I can't paint. And those things are some of the learning that we make within our education systems and society about what art is. We have specific ways that we think art should look. We think that there is good art and bad art. In art therapy, it's actually about what it is for you, what's coming out of your imagination. What are you needing to express? That is your art. That is your body of work. So it's really a place without judgment. It's a place of where you can create and see what comes up for you. There's also, I'm a good artist, so art therapy will be good for me, not necessarily. I'm a very big advocate for finding what works for you. And if you have a really good art practice, sometimes it's hard to break away from that. So if you're a really brilliant painter, it might be really hard for you to get into um, art therapy and let go of some of maybe the rules or skills that you really, really um, prescribe to. May or may not. I think it's a great way to expand your practice, but for some artists, it's hard to break away from some of the rules because in art therapy, it's not about the rules, it's actually about expanding and finding what you have to express and not really thinking about how other people look at your art. Um, in the art therapy space, when I'm working with clients, the art is just like a conversation. So if you were telling me something, it would be confidential. In the art therapy space, the art is also confidential. So it is very important to be able to let go of some of those judgments that we make of ourselves. And part of my work as an art therapist is also to help clients to break out of that and just express freely. So like I said, art therapy is about getting to your personal thoughts and feelings. Specific skills and or interests are not a requirement. So you don't have to have certain skills or be a certain way to come into the therapeutic space. It is a very open practice and an open therapeutic modality. So I did want to go into art therapy and brain injury community for those living with brain injury. There are many studies that support the use of art therapy for brain injury. I didn't want to quote all the studies and make this presentation about that. But I did want to focus on how art therapy addresses effects from brain injury. So just from looking at Brain Injury Canada, there are 4 different areas that can be affected by brain injuries. So I thought I would go through those areas and relate to how art therapy can help in those specific ways. So one of the effects is behavioral, and if there are behavioral effects of brain injury that are happening or surfacing, art is a really good way to redirect behavior and can calm and can be a calming activity. As art therapists, we have a lot of different activities for how our clients present or what our clients are dealing with. So, there are some activities I will give my clients if I really need them to be more active or more energetic. And then I also have activities that I can give for my clients that can calm everything down and think about calm spaces, safe spaces, and setting up those type of um, concepts or images for clients for their mind. Art can also be a way to reflect on behavior. So it can be just like you would write in a journal about, well, what I just did. It can also be an image that reflects what just happened. Now it's removed and you can look at it in a different way. So it provides perspective for behavior, but it also provides the redirect for behavior. And in the same note, from a cognitive point of view, if there are cognitive effects from brain injury, art is a very flexible modality. And sometimes it's presented as not with a lot of rules. But in the art therapy space, I truly believe that it's a freeing way of working. It can be scaled for cognitive levels of the client. So if there are memory issues, art can be used to work on memory. There's actually studies showing that art therapy can help with memory issues. It can also help with thought processes. So if there are behavioral effects happening using art, we can actually, as art therapists, work on the behavior by working on thought process as well. So there is a cognitive behavioral component to art as well, because the idea is to see how you're thinking about a certain situation and then create change in how you are maybe coping with it or how you are seeing that situation. And that is another driving force in art therapy. And I think that's a huge benefit for those that are struggling with memory or thought process and behavioral components. And I think the other important part is sometimes when there are brain injuries and there are a lot of medical and rehabilitation components going on, the emotional can get lost. As human beings, we're emotional beings, and sometimes when there are struggles to express maybe verbally, or there are struggles to express because of memory or just cognition in general, or thinking components, art therapy can really help with expressing new and emerging emotions that could be occurring because of brain injury, but also as we go through that process of how life changes and what it means and all the struggles, it gives a way of expressing without having the pressure to express verbally as well. So a visual representation of a feeling, for example, a visual expression of how things have changed that maybe is hard to explain in words or hard to explain to someone through a conversation. Art therapy is also very flexible in terms of physical ability and can be scaled for physical effects like mobility issues or sensory changes. In a studio, there's so many different options, and I'll show some examples of artwork as well that will give an idea of what's possible. If the client is more tactile and likes to use hands, and there's clay and different material we can use. If it is, if it's more stationary work that we need to do, then there's so many options there. So it's really very flexible with different possibilities for the clients that we work with. I wanted to show some examples. These are all my work, so things that I have done in studio as part of, as art therapists, we're encouraged to have our own practice to debrief ourselves and our feelings as well. So I thought I would share that because then I'm not sharing client work, but to show just the range of what's possible in an art therapy studio. So you can work with things like clay. If those types of materials are difficult or not comfortable even for clients, that this middle image here, sometimes I go and find things or found objects and then make art from that. You can also have things like collage, scribble art. If that's the case, that's also really accessible. So really stepping away from what it looks like. Is it looking like a masterpiece? That's not what we're trying to do in art therapy. It's about expressing a feeling and what are we trying to get out, and really being free to express what's going on. Again, sculpture, installation, bringing in other things. Not everything has to be created from scratch. It could be something that expresses what's going on with us and expresses emotion. I wanted to just share that really quickly. And the last component I wanted to share with everyone is finding an art therapist. So yeah, we're here. How do you find us? So one of the things I really want to highlight is if you find an art therapy institute. Vancouver Art Therapy Institute, Toronto Art Therapy Institute. I believe there's one in Kamloops. if you're in BC. But if you search that up, there are a few other schools that I haven't mentioned. Art therapy institutes typically have free and or affordable clinics run by student art therapists. And if that is, there's an access issue because of price or not having insurance or coverage or what have you, that is a really good way to go. There are sometimes organizations that offer internships for art therapy students. So that's another way to access art therapy as well, because if you find an organization that's willing to provide a practicum space or has provided a practicum space for student art therapists, then that can be part of how you access it. And now, if you're looking to access an art therapist, just for yourself, and you'd like to find one in your area, the best way is to go to the Canadian Art Therapy Association directory, and I've included the link there. But you can also Google CATA Art Therapy, and you will be taken to the Canadian Art Therapy Association website, and there's a directory of all the art therapists that are registered or have professional membership with the Canadian Art Therapy Association. And you can search by location and you can see our bios and see what our specific areas are that we work with. And that concludes what I have to say about art therapy. And I would be willing to take a look at some questions now.
Thank you so much, Swetha, for your presentation. We do have a few questions here. What if art therapy triggers anxiety in someone? So how do you work with that? How would somebody manage that?
Yeah, definitely. Just like any other way of expressing ourselves, art can be a trigger, especially if there are negative experiences with it. I am completely aware of how sometimes art is and art comes up, especially in our education system. I'm actually also an art teacher by training as well, so I know how that shows up, and that's one of the first places where, as children or as youth, we step away from art because we think we're not good at it, and there's anxiety there. I would say definitely, if you are interested in art but you're worried about the anxiety, have that conversation. Every therapist will or should be having an opening conversation with you when you step into the therapy space. Have that conversation. Say, I'm concerned about anxiety. I actually work with teens who have anxiety, and I use art therapy to cope with that, to help them cope with that anxiety. There's a lot of grounding that can happen in art, so I don't want to talk about just the benefits of it. But if there is a trigger, definitely identify it with the therapist, and then see if the therapist can actually support that trigger. I'm also a huge advocate of finding a therapist that works for you. I also tell this to my clients too. If I'm not your person, I want you to feel very free to find someone else or tell me and I'll help you to find someone else. And I think that's a really, really important conversation as well, not to force yourself into a therapy space or even a therapeutic relationship with a therapist unless it's comfortable. And I think that the anxiety piece is really important. If you can have that conversation and if your therapist can work with you on that, I think that's a really positive relationship.
Wonderful, thank you. And then our final question is, how do I encourage my family to use art therapy as a coping technique? So what would you say? What would be some tips for when I'm trying to encourage someone to take that step?
Um, um, so encouraging family to use art therapy as a coping technique. So that's a bit of a you can encourage, I think, by giving information. Sometimes, just like I was when I was speaking, um, it's difficult to get through the misconceptions sometimes, especially if you've never done art therapy. Art therapy is not like art. So a lot of what I was saying right now was about how art class, it's not like art, it's not an art class. It's not creating a masterpiece and putting it in the gallery. It's not like those things. You can do those things if you want, and if that's what you want. When you go into art therapy, it's not those things. So it's really this like very much a different way of working with art. Um, I would try to encourage family by giving them the information. So even sharing some of the information pieces that I was giving out in the presentation about what art therapy is. The Canadian Art Therapy Association website is a great resource that could be somewhere to start. A lot of art therapists, if you go through the directory, have their own websites where they talk about their own practices. So it would be really about sharing information about art therapy and also some of the things I mentioned in the presentation too. It's a very flexible and scalable model of therapy. So I hope that answers that question.
Yes, it does. Thank you so much. Thank you, Swetha, for joining us today and showing your insights into your practice. It's new for me, so I'm very interested in it. It's something I actually might consider trying because, like you mentioned in the slides, my first thought was like, well, I'm not very good at art, so I don't know if this would be something for me, right? I think it's very relatable response for a lot of us or people like myself where I'm not that creative, but I definitely will give it some consideration. So thank you so much for your time today, and we'll talk soon.
Actually, I just see
Oh,
another question pop up.
oh
So
yeah, of course.
yeah.
Go ahead.
So the question is for someone who finds it difficult to come up with something original or creative or an idea. How do we start creating something that is therapeutic? So that is my job as an art therapist. So if you come in and say, I've never done this before, and I say, great, don't worry about it. Art therapists, we can give directives. So directive is I will say, okay, Carissa, I would like you to do this today in studio. So that's where we will scale according to what the client is able to do. So those pieces. So when I said, if you're not an artist, you think you can't paint or you can't draw, that's my part of my job to work with that. So really, if that's one of the things stopping you, I would really encourage you to go and try it because that's part of my work as an art therapist is to make it accessible and find ways to create those possibilities.
Thank you so much for catching that. I just missed that one on its way in. Much appreciated. All right, Swetha, thank you again, and we'll talk soon.